Right now in Florida, constituents demanding answers from their elected representative when it comes to repealing the Affordable Health Care Act. In Newport Richey, a packed room with angry voters confronting Republican Congressman Gus Bilirakis.
I am 77 years old, and I think it's unconscionable for this politician to tell me that at 74, I will be facing death penalties.
I live so close to the poverty line. The first year, I was not sure I would be over the poverty line to qualify for any coverage under the Affordable Care Act because our state chose to not expand Medicaid. Had I been under the poverty line, I would not have been covered for anything. I would have gone straight from disability to uninsurance and would have ended up back on disability within 6 months without access to my medications.
Taking away the Affordable Care Act and the help that I receive while in the donut hole will no doubt bring me down to poverty level. Aren't there enough women already in poverty due to divorce and death? Do we have to add medical poverty?
Let's talk about this. Joining me now is Avik Roy. He's an opinion editor at Forbes and was a healthcare advisor to the Romney campaign. Good day to you.
Hey, Chanel, how are you?
As you can hear, so much pushback here on repealing Obamacare, not just in Florida, but around the country. So give me your take. How will this affect how the current health care law is reformed? I mean, surely they're listening.
Well, I think it's actually good for Republicans to have this conversation with their constituents now because it drives home the importance of their solution having answers to those who did get coverage through Obamacare. Now, a number of the people in your clips are people who are on Medicare who are over the age of 65, so they wouldn't lose coverage. And it's important to remember the ACA reduced Medicare spending in 10 years, cut Medicare spending by $850 billion. So if they're concerned about changes to Medicare, the ACA is responsible for that. However, Republicans do need to have answers to these very important questions.
So take me behind the scenes here. So we have Republicans here who have been opposing the ACA and running it on getting rid of it. They still don't have a replacement plan. I recognize that that's probably not easy to come up with, but what are they waiting for? And if this reform goes down badly, I mean, will Republicans have to own this?
Well, listen, I mean, Republicans are united in what they're against. They're against Obamacare. They're not yet united on what they're for. There's some broad agreement in terms of principles, but the details really matter because Republicans, in my view, need to put forth a replacement plan, a reform plan that covers roughly the same number of people as the ACA, or at least the people who got coverage of the ACA, who really wanted coverage and needed it and couldn't get it before. So that's a very important benchmark for Republican plans, and it's going to take time for the House, for the Senate, for the White House to work together and figure out how exactly they want to do that.
I want to get your thoughts on this. There's a new Quinnipiac poll here. It's half the country now saying they don't want Obamacare repealed compared to 46% who do. So this appeared to certainly be a winning issue for the president on the campaign trail. Now, in some ways, it feels like it's turned around. But here we are again with just such a divisive issue, 46%, 50%. What's your take?
Yeah, I've been following these polls for a long time, and they're actually very consistent. People don't approve of the ACA. They don't think it's lived up to the promise and the hype of reducing the cost of health care, which is the #1 concern for most Americans. But they also don't want to go back to the system they had before the ACA. And so what Republicans need to do is find that sweet spot where they can talk about fixing the parts of the system that are broken, but keeping the things about the ACA that people actually really like.
What about the lack of availability?
That's going to be a challenge for them. The lack of availability of insurance plans, absolutely. That's extremely important to fix. And to do that, you have to change the regulations in Obamacare that drive insurers out of the market. The problem is a lot of those regulations they can't change unless they get 60 votes in the Senate for the plan. That means working with Democrats like Chuck Schumer who are not eager to cooperate with what Republicans want to do.
So then look into your crystal ball, the one that I know you have. What do you see going forward? I mean, obviously, I don't know. Are they trying to rush this? Are they not? I don't know.
I think it's going to take a lot longer than they were hoping and expecting to come together and come to agreement on a plan that has 50 votes in the Senate, let alone 60, and that is competitive with the ACA on coverage. Because there are a lot of technical details they have to work out to get there. It's going to take time for members to come to agreement on what that is. And I think this could go into the fall and maybe even the winter.
Do you think Republicans know, listen, ultimately by 2018, I mean, would they be at risk if they don't get something done?
I think a lot of their voters will be depressed or upset if they don't fulfill that promise of repealing and replacing Obamacare. But here's where the rubber meets the road. They're going to have to come up with a plan that, again, is competitive with the ACA on covering the uninsured, the people who really need access to coverage, but do so in a way that reflects their principles of less government intrusion, lower costs, and more competition. They can get there. But right now, there's a lot of debate internally. It's not that they don't have a plan. There are actually 7 or 8 plans. And putting those plans together so that they actually reflect a broad consensus, that's what's going to be hard.
Yeah, easier said than done. Avik Roy, thank you for your time today.
My pleasure, Chanel.